Welcome back to Gastro Vision. Today, we're exploring a sophisticated approach to hepatic segmental anatomy, visualizing liver segment 5 by following the middle hepatic vein from the mid-stomach. We begin our journey at a familiar landmark, the gastroesophageal junction. From this position, you'll first identify the inferior vena cava, your primary reference structure. Look for the right hepatic vein draining into the IVC. This appears as a tubular anechoic structure, entering the IVC from the right side of your screen. The right hepatic vein is your first checkpoint. Think of this as establishing your starting coordinates. The IVC and hepatic veins form a consistent anatomical map that guides us to our target, segment 5. Now comes the critical maneuver. From the IVC, perform an anticlockwise rotation of the endoscope. This is the opposite direction from our previous hilum visualization. Precision in rotation direction is essential. As you rotate anticlockwise, watch carefully. The middle hepatic vein will come into view, appearing as a vessel running through the hepatic parenchyma. The middle hepatic vein is your golden pathway to segment 5. Remember, the middle hepatic vein serves as an anatomical boundary, separating the right segments from the left medial segment. Understanding this relationship is key to accurate segmental identification. Here's where technique becomes art. Once the middle hepatic vein is visualized, you need to trace it distally towards segment 5. How do we do this? Push the endoscope downward from the gastroesophageal junction toward the mid-stomach, while maintaining that anti-clockwise torque. This isn't a single motion. It's a coordinated push and sustained rotation. Think of it as following a river downstream. The middle hepatic vein is flowing from the liver parenchyma toward the IVC. We're traveling in reverse, from the IVC up the middle hepatic vein into the liver substance. As you advance the scope, you're transitioning from the cardia to the midgastric body. This positioning gives you the acoustic window needed to visualize the deeper hepatic segments. As you continue pushing the scope down while maintaining anti-clockwise position, segment 5 begins to emerge on your screen. You're now looking at the right anterior inferior segment of the liver. What defines segment 5? It's bounded superiorly by segment 8, medially by the middle hepatic vein, and segment 4B, laterally by the right lateral fissure, inferiorly by the liver edge. Segment 5 typically has a triangular appearance on EUS, with the hepatic parenchyma showing the characteristic fine, homogeneous echogenicity of normal liver tissue. Now here's a crucial anatomical pearl. Look for the gallbladder. The gallbladder appears near the transducer as an anechoic or hypoechoic structure with a well-defined wall. Notice the spatial relationship. Segment 5 lies inferior and slightly posterior to the gallbladder. The gallbladder actually sits at the junction between segment 4B and segment 5, making it an excellent landmark for confirming your position. If you can identify the gallbladder, you can find segment 5. This relationship is consistent across patients, making the gallbladder one of your most reliable reference points for right anterior segmental anatomy. The gallbladder fossa essentially marks the boundary between the medial and anterior segments of the right liver. Mastering segment 5 visualization expands your EUS capabilities significantly. By following the middle hepatic vein from the mid-stomach, you're employing a reproducible, anatomically based approach that works across diverse patient populations. If this video enhanced your EUS skills, please like, subscribe, and hit the notification bell for Gastro Vision. Until next time, keep refining your technique and keep pushing the boundaries of what's possible with endoscopic ultrasound.